But reality is getting ready to bitch slap all of us, and this fall is not going to be fun, guys. And I don't know what's going to happen. And there are mass outbreaks of monkeypox. And the government doesn't have the will to shut us down again, thanks to all the right-wing nonsense and propaganda. Because I think it's going to get to the point where all of us are going to need to sit at home for a couple months here again. And wait this one out, but I don't think that's gonna happen. The Biden administration today declaring monkeypox a public health emergency.
Today, declaring the U.S. a public health emergency over the nationwide monkeypox outbreak. A senior White House official confirming that to ABC News. We are told this will free up, if you like, additional resources for vaccines, treatment, and the tracking of the spread of this disease. More than six.
I was talking about it earlier. And I was like, have I been vaccinated for smallpox? When did, well, like, I'm pretty sure they phased out the smallpox vaccination. And fuck, I don't remember the date now. It was like 1972. So no, I have not been vaccinated against smallpox. Following a 1971 recommendation, it was phased out throughout the 70s. Phased out in 72. We're gonna have to vaccinate a whole bunch of people, and guess what? The right-wingers have been working overtime to make as many people as they can skeptical of vaccination. And we're going to need mass vaccination efforts to combat this.
6,600 cases of monkeypox have been reported in the U.S. so far. We will have much more on this as the story develops.
6,600. Wow, the video.
Thanks for checking out.
The rest of the video was just George Stephanopoulos. Let's talk about cases around the world. I'm going to throw some numbers at you that are startling. We're moving to the fact box. Monkeypox cases around the world from Reuters. More than 70 countries where monkeypox is not endemic have reported outbreaks of the viral disease, which the World Health Organization has declared a global health emergency. As confirmed cases crossed 25,000, and non-endemic countries reported their first deaths. Phoebe, good evening. Brazil reported its first death on July 31st. India reported its first death on August 1st. Spain reported its second death on July 30th. Below is a list of non-endemic countries that have reported monkeypox cases: Australia, India, Japan, New Zealand, the Philippines, Singapore, South Korea, Taiwan, Thailand, Andorra, Austria, Belgium, Bosnia, Bulgaria, Croatia, Czech Republic. I bet the Czech Republic, I bet those Czechs, they have some wild get-togethers. I've seen them. I've seen them. I've seen the porn. They got way more than 25 monkeypox cases because they get freaky in the Czech Republic. Denmark, Estonia, Finland, France, Georgia, Germany, Gibraltar, Greece, Hungary, Iceland, Ireland, Italy. I'd like it. Fucking shit. Peru had 340 cases. The United States, 6,617 cases. It provides, like, I think the efficacy rate was something in the high 60% or low 70%, Dustin, is what the smallpox vaccine provides against the monkeypox. So some amount of protection, and it's a game of numbers, as we've learned from the COVID pandemic. The UK has identified new symptoms. So, hey, Warlord, mad props to the eggheads over there in your country. UK health officials identified new symptoms. It is important to recognize that just one or two genital or anal lesions or lesions in the mouth can be signs of monkeypox, especially if you've had a new sexual partner, says UK Health Security Agency.
I'm here to give you a kind of a little snapshot of my life in quarantine with monkeypox.
After catching the virus in May, Peter Kelly
let's watch this.
in isolation.
I use a lot of gloves when I'm dealing with the wounds.
All to protect others from getting infected.
This is my little wound care / medication.
Oh.
Meds and Band-Aid changes were a daily routine.
For those of you who don't know, I have a real, like, I have a about medical stuff, any kind of medical stuff. Like, please don't give me monkeypox. I don't know that I can leave this room until all this shit is over. I don't know if I can do it because I can't do the monkeypox. I can't do the wound care like that. Like, it fucked me up. Give me the heebie-jeebies.
To heal more than 24 lesions.
And yes, if I've never said this to you guys before, I have never had anything done medically. I've had, like, wisdom teeth taken out. That is the closest I've come to having a procedure or surgery of any. Never broke a bone, never been in the hospital for anything, never been cut open, and it weirds me out. Ooh. So, like, I can't get the monkeypox. But unfortunately, we live in a society where we're not going to give people the tools to be able to stay home to avoid getting and spreading the monkeypox, apparently. I don't know where this is going to go in the fall, but it doesn't look pretty.
I honestly have never experienced something so painful.
Monkeypox, also known as MPX, has been spreading globally for the first time this year. Patients are told to isolate until their lesions heal, a painful process that can take weeks.
Many folks during that long period, if they're forced to isolate, are not going to be able to go to work, are not going to be able to pay their bills, pay the rent.
People want to follow public health measures, but they need to be supported in certain instances to do so.
In Toronto, more than 50 confirmed or suspected cases are now under investigation, mostly among men who have sex with men. It's the same trend seen in other recent global MPX outbreaks, though this virus can infect anyone.
We really need to be doing...
I got a growth on my pegger.
In order to ensure that this doesn't become a bigger problem.
Dozens of organizations supporting Canada's queer communities are calling on the federal government to provide financial support for...
And this is not good. This is not good because it doesn't exclusively affect gay men. And it is going to come for your kids. All the kids gonna get it in school. Remember, we are reaching the point where kids are starting to start school this week. By the end of the month, something like 80% of the schools in the United States will be back in session. And the kid's gonna get the monkeypox. And the crazies are gonna be like, I thought it was a gay disease. Who's giving the kids the monkeypox? The teachers are grooming the kids. And it is gonna be a shit show. The kids are already getting it, Warlord. I'm getting ready to tell you that here in just a second.
For people off work with MPX to help them isolate safely.
It's important to note that gay, bi, and queer men have long been at risk for housing and income insecurity.
For Peter, a dancer and personal trainer, catching this virus meant he wound up losing more than 20 days of work. But today, he got some good news.
I am currently out of quarantine, which is really, really great.
Now he's hoping others don't have to go through his experience. Lauren Pelly.
Health officials in the UK have updated the case definition of monkeypox to include new symptoms associated with the disease. A single lesion or lesions on the genitals, anus, or surrounding area, lesions in the mouth, and anal pain or bleeding, especially if the individual has had a new sexual partner recently. Please, guys, please don't have no new sexual partners for just a few months. Just keep it in your pants for a little bit. You can do it. I'd do it. Keep it in your pants for a few months. Nobody have sex with any, if you're already having sex with somebody, you're good. Okay? Don't have any new sexual partners, and watch yourself being in close contact with anybody. Anybody. Oh, the majority of people with monkeypox can safely manage their symptoms at home, and there have been no reported deaths in the U.S. Most people experience mild symptoms, but it can cause a significant illness in some, requiring hospitalization, including for severe pain. Unfortunately, when it comes to hospitalization, we're seeing a little problem. There are lab techs who are not being given, this is the same old story, same old song and dance. I don't think this video has anything to do with the story. This is what we ran into with COVID, that healthcare workers are not giving proper PPE. Some lab techs refuse to take blood from possible monkeypox patients, raising concerns about stigma and testing delays. Many technicians at LabCorp and Quest Diagnostics, two of the largest commercial labs in the U.S., have been refusing to draw blood from patients who might have monkeypox. LabCorp and Quest don't dispute that in many cases, their phlebotomists are not taking blood from possible monkeypox patients. What remains unclear after company statements and follow-ups from CNN is whether the phlebotomists are refusing on their own to take blood, or if it is the company policy that prevents them. The two testing giants say they're reviewing their safety policies and procedures for their employees. Infectious disease experts who treat monkeypox patients say that the refusals are based on stigma and slow efforts to identify and isolate patients with monkeypox at a time when the nation's health officials are coming under criticism for struggling to get the outbreak under control. As of Tuesday, there were we're now up to 6,600 cases of monkeypox, an 81% increase from a week before. An 81% increase from a week before. This is absolutely inexcusable. It's a grave dereliction of duty, said David Harvey, executive director of the National Coalition of STD Directors, which represents 1,600 sexual health clinics in the U.S., some of which have phlebotomists from commercial labs, including LabCorp and Quest, in their offices. The commercial labs employ tens of thousands of phlebotomists, healthcare professionals who draw blood in various types of clinics and doctors' offices across the country, as well as their own patient services center. Although monkeypox is diagnosed by swabbing lesions, blood tests are necessary to differentiate the virus from other types of infections, infectious disease experts say. So, compounding the problem. And as I mentioned before, the kids are going back to school. The college kids are going back to school. The college kids are going back to school.
School year in which a contagious virus is a growing concern. With the increase of monkeypox across the country, health officials are urging schools to put plans in place right now for testing and treatment and vaccinations. Action News reporter Bob Brooks joining us live in Center City, Philadelphia tonight. Bob, they say right now.
What up, Bob?
Time to act.
Yeah, Brian, that's right. That fall semester is now right around the corner, and health experts say students, they need to be fully aware of what is going on now. Soon, the universities of Philadelphia, the Delaware Valley, and beyond will be bustling with students yet again. And now there's another.
I feel like nobody's talking about it. You know, I'm showing you clips of news coverage, but I feel like when it comes to social media and shit, I don't think anyone's talking about it. Fucking shit.
Another health concern medical experts say they need to be aware of, that's monkeypox. Tonight, Dr. Delana Wardlaw with the Temple Health System says monkeypox could very well be a factor come this fall semester.
Anything is possible, Bob. We just have to make sure that we're using policies and procedures and protocols and the resources that are available to us to try to reduce the transmission.
So she says tonight she wants students to understand how the virus spreads.
You want to make sure that you're, one, not sharing any personal items. 2, you want to make sure you're not sharing any bedding or anything. 3, you want to be aware that it is contracted through close contact, skin-to-skin contact.
And if someone gets it, she says, it's imperative they isolate.
If people are showing signs and symptoms, people need to be responsible.
Earlier today, we spoke with a man from North Philadelphia who has contracted the virus, and he's endured 8 days of painful symptoms, including the pox marks.
It still hurts, like some of the bumps hurt. Itches.
As of August 1st, Philadelphia has had 82 confirmed monkeypox cases. Pennsylvania has had 170, and there's been 155 in New Jersey and 5 in Delaware. Meanwhile, the monkeypox vaccine has been rolling out to various locations around the country, but the director of the Chester County Health Department says they only have enough vaccines for those who've had close contact. There's not enough for the general public yet.
We don't know what this is going to look like in terms of how quickly.
And there won't be for months.
Now, Brian, we want to talk a little bit more about prevention. Dr. Wardlaw says there's another simple way, effective way to prevent the spread of monkeypox, and that is to just wash your hands frequently. From reporting live in Center City, Bob Brooks, Channel 6, Action News. Brian.
So, hey guys, wash your hands frequently. Wash your hands frequently. Wash your hands frequently. Try to keep it in your pants. Try to keep the sexual anarchy to a minimum.
You live in sexual anarchy?
Do sexual anarchy with the people that are already in your lives. If you want to bring new people into your lives, do it virtually. Talk to a cam girl or something. I'm just saying. Here's the kicker. Remember I said the kids are going to get it. We're up to 5 children's now in the United States. I don't know what stingray you're talking about. Stingray, you're please explain, RB.
Tonight over monkeypox. At least 5 children have now tested positive for the virus across the U.S. 2 of those cases in California, another 2 in Indiana, and officials say the 5th case involved an infant who was not from the U.S. but had been traveling through the Washington, D.C. area when they tested positive. I want to bring in Dr. Peter Hotez. He is with the Texas Children's Hospital, joining us tonight to talk more about monkeypox.
Hotez is the man. Take whatever this guy says as gospel.
Doctor, always good to see you. Appreciate you giving us some time tonight. Reviewing the CDC's guidance on this, they said that kids under the age of 8 are at a, quote, increased risk for developing a severe illness from monkeypox. Do we know why that age group is more vulnerable?
It's based on data coming out of both Central Africa and West Africa, because the mortality rate out of West Africa was described around 1%, somewhat higher in children. I think it has to do with the maturity of the immune system. We don't have a lot of details about it, but the point is,
and also he's got a book about Stalin behind him. I can't tell what the book is. It says Stalin and Scientists on the cover, but I can't tell exactly what the rest of it says. Maybe he's signaling to everybody he's a comrade. But also, I don't...
cases.
Oh, you're Charlie Kirk's stingray face. You're saying Charlie Kirk's face looks like a stingray.
You live in sexual anarchy?
Oh, okay, I can see it. You were freaking me out. I didn't know what it was.
Continues to grow in the United States, over 6,000 reported cases. The real number is probably significantly higher. We should expect spillover from the current high-risk group into the general population if we allow those cases to continue.
The book is Stalin and the Scientists, A History of Triumph and Tragedy, a popular science nonfiction book of the history of the science of the Soviet Union under Joseph Stalin. Interesting.
Need to grow.
So are we adequately responding at a federal level and then state and local level to where we're seeing things right now? Because every morning I feel like we wake up and there's more new cases. Now we're seeing kids infected.
Yeah, it's a pretty steep trajectory, and the worry is that we just do not have the vaccine doses, nor the doses of the medicine, the tecovirimat, also known as TPOXX. You know, there were a lot of lapses, unfortunately, in the federal government. We had
he's in high demand.
A significant number of doses stockpiled of the vaccine. We allowed it to expire, and it wasn't replenished in time. This vaccine was approved in 2019. It was supported heavily by the U.S. government, and then we allowed the doses to expire. So it's a really difficult situation. Now we're trying to play catch up in order to acquire as many doses as we possibly can. The Biden administration is now, trying to work fast and furious on this. We have a new monkeypox coordinator and deputy coordinator, but we're not going to get the millions of doses that we need over the next few months to really quell this epidemic.
A lot, Mox.
Can we do more with the antiviral drug and use that as a form of post-exposure prophylaxis or a form of pre-exposure prophylaxis to make up the difference? So I think they're looking at all of those possibilities, and we also have shortages of diagnostic testing, and our healthcare system is not as set up as it should be. So we're coming at this from behind, and it's too bad because unlike COVID-19, the vaccines were already invented and developed, and same with the antiviral drug. We just had too many lapses in our system.
It just doesn't seem like we should be in this position. Not only that, the vaccine.
But I want to make like Hotez and Osterholm. Those are like the two epidemiologists, virologists that like you get all your information when it comes to COVID, monkeypox. You listen to those motherfuckers. That's why he's got the nice microphone. He is in very high demand.
And correct me if I'm wrong, not approved for people under the age of 18, right? So the kids in the high-risk category still couldn't receive it.
Well, but for there, we could probably do some immunobridging studies, just like it was done with the COVID-19 vaccines for kids. So I'm not as worried about that, but it's a matter of having, if the doses of vaccine are just not there in the stockpile, then there's not a whole lot you can do other than try to hope that we can move as quickly as possible on that front.
Doctor, before I run out of time, I know monkeypox is spread in several different ways. How is it transmitted, and what's your message to the public on trying to prevent the spread and protect themselves right now?
There seem to be several different modes of transmission: respiratory droplet contact, somewhat similar to influenza, but also skin-to-skin contact, oral-to-skin contact. So it's close, fairly intimate contact. Most likely the kids that were infected is through household transmission. It's not as easy to spread as it is COVID-19, and you really do not have the problem of asymptomatic individuals. So in theory, it should be easier to do the contact tracing and control.
In theory.
It would sure be a lot easier if we had all of the tools available right now.
Well, we're playing catch up. It's in almost every single state right now. Dr. Hotez, appreciate your time tonight. Thank you.
That is my worry, that we have already fucked it up. We have already fucked containment up. We have already fucked containment up. It is gonna spread all over. That's why I'm saying, like, I ain't leaving the room, because like fucking almost everybody in the country gonna get it.
Tonight in our missing
oh
series,
shit,
we are focusing
fucking shit, that scared the fuck out of me. We're like at the same point that we are with COVID, just everybody gonna fucking get it, and that scares the fuck out of me. I don't want to get it. I didn't want to get COVID. What the hell? What the hell? Why do we have to be like this?